Your call may be recorded to monitor quality.
All right, well, let's see if we can get your application approved for you. Next, I will be asking you some medical questions that will require a yes or no response. And have you ever been declined for health insurance?
No.
Any existing medical conditions like heart problems, diabetes, cancer, HIV, alcohol, drug abuse, or mental health treatments?
No.
Any pending doctor appointments?
No.
Any diagnostic testing, treatment, or surgery been recommended or scheduled yet to be completed?
No.
Are you an expectant parent or in the process of adoption?
No.
And do you take any prescription drugs?
No.
And are you a smoker?
No.
And are you a U.S. citizen?
Yes.
Okay. And then the best phone number to reach at was the one you gave me earlier, 390-4898?
No, it's 310.
Oh, good thing I double-check. Within the last 5 years, has any proposed insured had any urgent care or emergency room visits?
No.
Within the last 5 years, has any proposed insured received treatment, testing, consulted with, or received a diagnosis from a doctor or other healthcare provider? Do not include annual physical exams.
No.
Excuse me. And within the last 5 years, has any proposed insured participated in any motorized vehicle racing, includes drivers, pit crew owners, or mechanics, or any of the following activities: skydiving, ultralight flying, scuba diving, hang gliding, rock or mountain climbing, or rodeo participation?
No.
And is any proposed insured currently pregnant?
No.
Now, have you fully disclosed all medical conditions for you within the last 5 years?
Yeah.
Okay. Now, do we have your consent to process your application for insurance based on your verbal authorization?
Yes.
Now, in order to get your health insurance approved, sometimes we need to order medical records. So I'm going to read an authorization to you that will allow us to call you to get a signature to release those records. This is kind of lengthy, so just bear with me, and after I'm done reading this, I'll get you an application number. Now, in order to determine my eligibility for insurance, I authorize any licensed physician, medical practitioner, hospital clinic, any pharmacy, pharmacy benefit manager, pharmacy-related entity, any medically related facility, insurance company, the Medical Information Bureau, employer or consumer reporting agency, to give an insurance company or any consumer reporting agency authorized by insurance company any information regarding me or my family as to employment, other insurance coverage, personal information, and medical or pharmacy care, advice or treatment or medication use. I represent to the best of my knowledge and belief that all statements and answers on Part 1 are complete and true. My recorded personal health history, Part 1, and any amendments shall be the basis for the contract. I also agree that within 30 days of policy delivery, I must formally accept the offer by verifying the accuracy of the enrollment form information with a signature and returning that signed acceptance to insurance company. Except as otherwise provided in the conditional receipt, the insurance, if approved by the insurance company, will be enforced only when issued by the insurance company and accepted by me. I understand and agree that any information I provide through this application process may be shared with persons necessary to facilitate issuing coverage, including but not limited to my agent or broker. If any of these conditions are not met, the insurance company has the right to rescind its offer of coverage, and the full extent of its liability shall be limited to the sum received. I hereby authorize any healthcare provider or medically related facility, pharmacy or pharmacy-related facility, the Medical Information Bureau Incorporated, consumer reporting agency, insurance or reinsurance company, or employer having information about me or my minor children to provide all such information as may be requested to its legal representative or any medical records retrieval service the company may engage, including but not limited to EMSI and its agents. Now, this authorization includes any and all information you have about me, including but not limited to information regarding diagnosis, testing, treatment, and prognosis of my physical or mental condition, as well as alcohol abuse treatment, drug abuse treatment, psychiatric treatment, pharmacy prescriptions, HIV testing and treatment, STD testing and treatment, sickle cell testing and treatment, prescription history, lab data, and EKG. This information may also be disclosed to the Medical Information Bureau Incorporated and any medical records company engaged, including but not limited to EMSI and its agents. Although federal regulations require that we inform you of the potential that information disclosed pursuant to this authorization may be subject to redisclosure by the recipient and no longer be protected by such regulation, all information received pursuant to this authorization will be protected by federal and state privacy laws and regulations. A copy of this authorization will be valid as an original. Now, I understand that this authorization is required in order to enable some insurance company to make eligibility or enrollment determinations relating to me and or my minor children, or for insurance companies underwriting or risk rating determinations. If I refuse to sign and revoke this authorization, the insurance company may refuse to consider my application for enrollment. I understand that I may revoke this authorization at any time by notifying the insurance company in writing of my desire to revoke. Such revocation must be sent by certified mail. Such revocation will not be valid if my insurance company has taken action in reliance on the authorization. Now, finally, unless an earlier date is required by law, this authorization expires upon the earliest of the following events: 30 days after denial of my application or declination of enrollment, or if insured, 30 days after when I am no longer an insured of my insurance company. But in no event will this authorization be in effect for longer than 24 months from the date signed. Do you agree with these statements?
Yeah.
Okay. Congratulations, you have been approved.